Slidell Memorial Hospital, your hospital for life.
Hello and welcome to another edition of HealthQuest, St. Tammany's response to meeting the medical needs of you, the citizens of our parish. My name is Bruce Clement. I'm the executive producer and host of the show. Today it's our pleasure to welcome back Dr. Jennifer Olivier. Dr. Olivier is double board certified in pediatrics and allergy and immunology. And today we're going to talk about adult immunizations. So for all of you who are resistant to taking your doctor's advice, we're going to try to encourage you today to protect yourself. So do you see in your practice, do you have more difficulty with getting adults immunized or children, Doctor?
Adults.
There you have it, folks. The truth is out. So, Dr. Olivier, you've told us in the past about how your medical training and how you ended up getting into this and your love of medicine even as a small child. Adult immunization now, so in your practice now you will treat anywhere, any age group?
0 to 99. And I've had
You've had some 99s?
Many 97, 95, 94-year-olds.
That's wonderful. That's amazing. Well, we're delighted. Dr. Olivier is the only allergy immunology specialist in the area and is in high demand. So if you need to see her, make sure you make an appointment early. So, talking about adults and talking about getting immunizations, it's kind of like, as a guy, it's like, oh, well, I guess I need to go see my doctor and get my annual visit, and maybe every 3 or 4 years. No, that's not true. My physician is pretty strict, and I have to go see him twice a year now. But why is it so important for adults to have immunizations?
It's very important because immunizations is a population thing. It has to do with the community. Let's say one is immunocompromised and another person who isn't but won't get their vaccines can actually carry a particular illness and spread it, especially to those immunocompromised patients, and now they may potentially die, like the flu.
And we're going to talk about the flu coming up. And there's been a general fear, or there's been a lot in the lay press about the dangers of some vaccines. What would you say to people that say, well, Dr. Olivier, I'm scared to get this?
I would say we have to outweigh the benefit and the risk. When it comes especially to particular vaccines, the risk is going to far outweigh any dangers. And now vaccines, you can say nothing's 100% and nothing's 100% benign, because again, vaccines are a foreign substance in your body, but the benefit that they contain is amazing. Just like polio, when's the last time you've heard of somebody being diagnosed with polio? You haven't. And that's because with vaccinations, it's particularly eradicated on our side of the world. There's some countries that don't vaccinate and still suffer with it.
Wow. So we talked about it lowers the chance of getting disease and then spreading the disease to other people.
Right.
One of the immunizations that's become very important, especially at this time of year, is the pneumococcal vaccine. Tell us about this vaccine, the importance, and why it makes such a difference.
Absolutely. And there's two particular types. When we're younger, as children, we get something called the Prevnar 13. And then also when we're 65 years and older, we get it again. Now, the importance of this vaccine is that it's connected to a protein. And anytime the immune system sees that protein, it's a more robust immune response, because now we have two branches of the immune system working together. Whereas your Pneumovax is a polysaccharide vaccine. This is one that's given to those with underlying health conditions like I don't have a spleen, I have heart disease, I have lung disease, and things like that. And that's given every 5 years to help prevent pneumonia. Also, we use it for immune deficiency evaluations because I'm trying to challenge the immune system to see if the body can respond functionally If not, of course, that would be immune deficiency, and that would predispose one to have more sinus infections or lung infections or ear infections.
You mentioned the two branches. What are those two branches?
So I'm thinking about T cells and B cells. They work together. Your B cells are responsible for making your antibodies, and your T cells are responsible for working out intracellular pathogens like your viruses.
You mentioned that getting this injection every 5 years, that's for children?
It's children and adults, absolutely.
And adults. I was under the impression, and probably incorrectly, that you got one pneumonia vaccine as an adult in your lifetime. It's not.
It's no longer the case. Actually, the CDC came out with new guidelines recently saying, at first it was just the Pneumovax at 65 years and older. Now we say give the Prevnar 13 first, and then 6 to 12 months later, give the Pneumovax.
So what about those patients that have had the Pneumovax at 65? Do they need to have the Prevnar also?
Absolutely.
They need to go back and get another pneumonia injection?
Absolutely.
Holy cow. So how effective is that pneumococcal vaccine?
I think it's generally effective. I think with most vaccines you could say 80–90%, but each vaccine is different. So when it comes to a particular vaccine of saying how effective is it, of course it's going to depend on your lot number, it's going to depend on who's making it, it's going to depend on how your body, if it can react to it. So we probably don't know the true functionality, but in general vaccines have a high percentage of being effective.
Yeah, and I think the most important thing I can take away from this particular vaccine is that if you are 65 or if you've had the single, what was thought to be the one-time lifetime dose, that is not the case anymore. You need to go back and get the Prevnar 13. So please make an appointment with your doctor if you're 65 and older. I don't know who that might be on this stage, but I'm just saying. So moving on to one of the most debated topics as far as vaccination is the flu vaccination. Influenza is deadly, and the media has done what I consider a pretty good job about trying to get the message out to people that we're not talking about just getting a runny nose and a headache here, folks. We're talking about you may end up in the hospital or worse.
Absolutely.
So what are the 5 cardinal symptoms of influenza?
Typically you'll have patients come in with high fever, body aches all over. They don't feel well, they feel run down, or hit by a Mack truck is a real common one. Other things can be sore throat, it can be cough, but the main things is you could feel like death, quote unquote. I think I had it when I was in medical school, and I swore I would never miss my flu shot ever again.
So, and working in the medical profession as I've done for 40 years, the regularity by what these annual injections, they do seem to have a very, very important impact in the community. And medical professionals are exposed to a lot of different things, and for those medical professionals that do get it, which a lot of us do, it's important that your family members get the flu shot also, because you get exposed to a lot of different things, and you can bring. How long, if I'm around someone, let's say, that has the flu, I've had my flu shot, and I go home, is there a chance that I could pass the flu on to someone?
If you have the flu injection, which is the inactivated one, no. Now, if you have the live virus, like the flu mist, which I think is less effective actually, that's a live virus. You generally still cannot pass it on, but you may have more symptoms from that one.
From actually taking the virus, yeah.
Right.
Yeah. Now, I've graduated to the stronger dose of the influenza vaccine, and with the only exception being a little bit of soreness at the site of injection, no symptoms whatsoever. So I don't know if you're hearing that in this year's vaccine or not, but there's really, I didn't get anything, a headache or anything.
Well, with any vaccine, one can expect to have 24, 48 hours of elevated temperature, 99, 100, and they may feel a little bit of malaise, and that can be normal, but that's a good thing because it tells you that your immune system is also working. It's trying to fight it off and be active. Typically, most don't have symptoms, but some may, and that's still okay. It doesn't mean you were given the flu, not by any means. The other misconception, people say, well, I got the flu shot, but I still have the flu. I'll say, well, the flu vaccine isn't there to prevent the flu. The flu vaccine is there to help prevent death and severe comorbidities with it. So even though you might hear these numbers, oh, it's only 10% or 30% effective, I'll take that any day over 0.
Yeah, because last year I think there were like 36,000 people that died from it and over 200,000 hospitalizations. One of the things that we saw last year was the fact that emergency rooms across the country were overrun with patients that came in with the flu or flu-like symptoms. And that created really a crisis for many hospitals in that they couldn't care for the life or death emergencies as quickly as they could. And I actually seem to remember reading that in California, the health officials were telling people, do not go to the emergency room if you have the flu, stay home.
Right.
Because you're probably going to give it to
Somebody else, right.
give it to some more people. And there's really, I guess it's a tough call because, at what point, because it can kill you, right? At what point do you then make the decision that I need to go to the emergency room?
I would say that decision would come into if you feel like it's life-threatening. One can't breathe, wheezing, possibly dehydration. If it's something like vomiting, like I'm coughing so much I'm throwing up, I can't keep anything down, something like that. If you have life-threatening symptoms, go to the emergency room. And everyone knows what that feels like. If it's just a fever, I'd say stay home.
Yeah.
A fever, feeling under the weather is not a reason to go.
Okay. Yeah. Because that shouldn't be your primary source of health care, but for many people, it necessarily is. Talk about what age group. When do you start getting immunized with the flu vax? And you have 100-year-old people that are still getting it. Is that right?
Absolutely, and the reason being, it's ages of 6 months and older. So the reason is at 6 months, that's when we feel like your body is mature through studies to handle the flu vaccine. Between the ages of 6 months and 8 years old, you need 2 doses if it's your first vaccination, and 1 dose every year after that. The flu vaccine changes every year, as we all know, and with the flu virus, it changes because it can change genetically. And we try to anticipate what that flu is going to look like from what other countries have seen. Like the Asian flu, when they have it, it's going to be a lot earlier in the year than when we get it. So we try to anticipate, okay, this is the flu strains that are affecting others right now. Let's get ready and have it manufactured by the time it hits us. And that's why certain flu vaccines might have different efficacy, is because we're not sure. I mean, when you deal with anything biologic, it can always change genetically, and that again can affect your effectiveness.
So the Centers for Disease Control, that's fascinating information. I wasn't aware that they actually look at what's happening in other parts of the world, and then that is how they determine which strains are going to go into. As a layperson might say, well, so why do you only have a few strains? Why don't you put 20 strains in there or more? What's the rationale behind that?
The rationale is that we want to target to be effective. If, let's say, one particular flu virus isn't affecting the population and another one is, let's target the ones that are making a difference and go after those. And typically you have 3 to 4 strains in those flu vaccines anyway.
Right. And I think the one this year, does the one this year have 4 in it? Is that?
You can have 3 or 4.
3 or 4, depending on which one it is.
Get.
Yeah, and they look across and see what's happening around the world.
Absolutely.
Important also to know that you learn what's out there, and then you begin to craft what the vaccination will look like. then the manufacturers have to go into a manufacturing mode. So you have to get at least, what, 6 months or more ahead of this before you can bring it, safely to market and get it out in the general population. So it is a bit of there's a lot of science involved in it, and it's a bit of a guessing game, but probably more science than guessing game.
Right.
Now you said that if you can still get the flu after you've had the flu shot, but it will be less severe.
Right.
And so does that mean you got a different strain than what was in the vaccination?
Well, you can have two different, like type A flu or influenza B, but again, in the vaccine you should have both. But the thing is, nothing's 100%. So you can still be infected with the flu virus, but instead of dying from it or being in the hospital because you could have secondary pneumonia, now you might just have some fever, you don't feel as good, and life moves on. The other reason is if you're already immune or medically compromised, like heart disease, diabetes, and you don't heal well, and at a baseline your function is compromised, imagine if you get hit by a truck like the flu, how bad off you will be. So everyone needs the flu vaccine. Even my immune compromised patients get the flu vaccine.
Do you administer these in your office?
We do not administer in the office, but we say pharmacies or primary care can administer them.
Right, and so that's a shift in medical technology and medical training over time, and now you can. And I've even seen some of the pharmacies will say it's no cost. You just come in and get it, and they'll bill your insurance company or bill the government, or I guess that's what they do. But it's certainly available, and it's certainly out there, and it does save lives, and it's
Absolutely.
Something that we're very, very concerned about.
Especially if you're around those grandbabies.
What about people with like egg allergies and that type of thing?
Very good question. Traditionally in the past, before 2012, we said if you have anaphylaxis with eggs, do not get the flu vaccine. That has now been overturned. Even if one is severely anaphylactic to eggs, still get your flu vaccine.
And is that because they've been formulated differently, or just?
It's because the protein, if any, is so minuscule, even those during studies of it didn't react to the flu vaccine.
Okay. And one of the, another vaccine that has become available and prominent is the vaccine for shingles.
Yes.
Having seen family members that have had the shingles, it is horrific and
Yes.
debilitating for those who get it. What we see in the literature is that it's astounding that 30% of the general population will get the shingles in some way, shape, or form in their lifetime.
Mm-hmm.
That is a huge number.
Yes.
How do you advise your patients when it comes to this?
I say it's always a good idea, because even though one has shingles and the course of infection is finished, you can still have neurologic issues after that. I mean, you can still have that nerve pain, and that sometimes never goes away. So why not get a vaccine that can help reduce those symptoms or that potential complication by 60%?
This particular virus, if infected with it, is it one that we get exposed to and it lies dormant, or is it, how does it work?
Very good question. So traditionally, if we all get the chicken pox, I had the chicken pox when I was younger, it does lie dormant in your nerve root cells. And then if the body is stressed, and I don't mean emotional stress like I'm planning a wedding or something like that, I mean body is stressed, any kind of fevers, had a heart attack, something to that extent, that can bring out shingles, because now your immune system isn't fighting as much, it's stressed, or let's say it's malnourished. Now you're allowing the virus will come out. And the way it functions, it's thinking, let me get out of the body and infect another host. This host is going down.
And so it's living in the nerve roots?
And that's why you'll see when people have shingles, it's along what we call a dermatome, a particular neurologic distribution.
Meaning?
Meaning, so if you have a particular area of your body, you could have it just on one side of the face. You could have it just around where your nerves are in your chest or on your sides, things like that.
Yeah. Talking about, you know, a lot of the research I saw was it was like a band around the waistline. Very, very typical. Is that what you see in practice?
Right, it could be there, and it could even, like I said, it could even be on the face, coming across from over the eye to under the eye, almost to midline of the face. And it can be very classic. It have the crusty looking like chicken pox. And if it's oozy, it's contagious.
So let's talk about the different vaccines that are available for that. Which ones do you use in common in your practice?
Most commonly now it's going to be the recombinant, and that's going to be the Shingrix. And the Shingrix is great because it's not a live virus vaccine. So if you are immunocompromised, you can probably still get that one. Whereas the live virus, the Zostavax, I would say that's a no-go for that one. So right now, the CDC is preferring doing the recombinant vaccine over that live virus one. Also, the Shingrix you can get younger than you can the Zostavax.
When do you start the immunization? What age would you?
You could do 50 and older with the Shingrix. With the Zostavax, you have to wait till you're 60.
Okay. And our final immunization that we're going to talk about today is Tdap, TD. What does that mean?
Very good. So Tdap is going to be your tetanus, diphtheria, and the A is acellular, and the P is pertussis, or the whooping cough. And the TD is going to be tetanus and diphtheria. So every 10 years, I'm sure most have heard, get your tetanus shot. Now with the Tdap, this is because what we found in about that 11, 12-year-old age group, they could have the whooping cough or spread the whooping cough. So now that's why you may see a difference in those vaccine schedules where when you're an infant, you get something called the D-tap. You get a little bit more big D diphtheria. But then when you're a teenager, that might switch when you're 11, 12 to the Tdap. And also we recommend that third trimester of pregnancy, because during that third trimester, that's where those IgG antibodies go to the baby. And then also, when we're 65 years and older around children, things like that, that immunity wanes as we get older. So that's why they might recommend, hey, even though if you've gotten another tetanus shot, get your Tdap. Let's help reduce this whooping cough that might spread.
You know, when I was growing up, we got tetanus shots, and we were preventing lockjaw. I remember that. And now we have this combination. It's several different things that we're looking at. So it's pretty cool that you can get that much protection in one injection.
Absolutely.
And it's every 10 years that you get a booster on that.
And with your Tdap, it's generally one lifetime dose after your primary series.
Okay. And the primary series is
Would
what?
be like when you're in infancy. But right now, if you're a youngster, you can say, all right, 11 and 12, I got it, that's your lifetime dose. Whereas when I was 11 and 12, that wasn't a recommendation. So I had to get an extra dose as an older adult, especially if I was going to be around young children, because I don't want to spread whooping cough to infants or young children.
So what if your patient comes in and says, well, I don't know. I mean, I know I had tetanus shots, but I don't know if I had all of this.
I would give it anyway.
Yeah, because you really, I mean, you're not going to go wrong by giving it
Right.
an extra one.
Regardless of when you had your last tetanus booster, you can still get that Tdap.
What do you see on the horizon as far as immunizations? And you know, you're very contemporary on your training, and we know that you're expert in your field. What do you see as some of the next steps as far as immunizations against different diseases?
I think the more and more we use our genetic capabilities, the more and more we'll be able to vaccinate against more disease. And it's amazing all the things out there that we can vaccinate against. It may not be mainstream yet, but especially when it comes to traveling to other countries, preventing other viruses, I think this will be coming once we really solidify the genetics of what these pathogens contain.
So there's a tremendous amount of work going on behind the scenes in
Absolutely.
laboratories right now using some of the advanced genetic capabilities that we've developed over the last several decades.
Absolutely.
And we're getting more and more refined, aren't we?
Absolutely.
Well, Dr. Olivier, we certainly appreciate, if there's one thing you can tell the adults out there about compliance, what would it be?
It would be protect yourself and your family.
Yeah, because you're really not just talking about yourself. It could be protecting children, grandchildren, and,
That's right.
and your significant others. Well, Dr. Olivier, thank you very much for sharing your knowledge with us today. From all of us at HealthQuest, we thank you for watching. Have a healthy day.